Dementia is not a simple disease. Losing memories can be one of the most frightening experiences for us. As part of the effort to understand the profound impact of dementia on our lives and society, Silver Queens have prepared an 8-part special on dementia. We will introduce what dementia is, its symptoms and prevention, methods, and ways for families and society to cope with dementia together. Hello, we are Silver Queens. Dementia is a familiar term to us, but there are still many misconceptions about it. Dementia is not just about memory loss. It is a complex disease involving cognitive function and behavioral changes. Today, we will address some misconceptions about dementia by answering 3 important questions. Are dementia and Alzheimer's disease used interchangeably? Dementia and Alzheimer's are related but distinct concepts. Dementia refers to a set of symptoms involving cognitive decline, including memory, thinking, language, and behavior. And it is not a specific disease but a syndrome. Alzheimer's disease is the most common cause of dementia, a progressive neurodegenerative disorder where brain cells are damaged, leading to a gradual decline in memory and cognitive functions. Alzheimer's disease is the most common form of dementia, affecting 60% to 70% of dementia patients. This disease primarily affects people over 65, and the incidence increases with age. In people over 85, nearly 1/3 suffer from Alzheimer's. The early symptoms of Alzheimer's begin with short-term memory loss. For example, you might forget recent conversations or events, or frequently misplace items. Additionally, you might struggle to find words or have impaired judgment. These early symptoms can sometimes be mistaken for normal aging, but may be the start of Alzheimer's. As the disease progresses, mid-stage symptoms include worsening memory loss, difficulty remembering names of family and friends, and problems with language and problem-solving abilities. Repetitive behaviors or compulsive behaviors may also appear, and the patient gradually withdraws from social activities. In the late stages, the patient loses independence in almost all daily activities and requires complete assistance from others. In the late stages, communication becomes impossible, and the patient often remains bedridden. Symptoms such as weight loss, decreased appetite, reduced physical function, and loss of obstacle perception ability also appear. The cause of Alzheimer's is not fully understood, but the accumulation of amyloid plaques and tau proteins is known to be a major factor. Genetic factors and family history also play important roles as risk factors. Specifically, the APOE4 gene variant is recognized as a major genetic risk factor for Alzheimer's. Dementia can result from various diseases, including vascular dementia and Lewy body dementia, in addition to Alzheimer's. Alzheimer's accounts for about 60% to 80% of dementia cases and primarily affects people over 65. Early symptoms begin with short-term memory loss, and as the disease progresses, symptoms such as confusion, aggressive behavior, mood swings, language difficulties, and long-term memory loss appear. Both dementia and Alzheimer's have increasing incidence with age, but this is not a natural part of aging. Dementia occurs due to brain cell damage, leading to cognitive decline. Alzheimer's is known to be caused primarily by the accumulation of amyloid, plaques and tau proteins, but the exact cause is not fully understood, and there is no cure yet. In conclusion, dementia is a comprehensive term referring to a syndrome, while Alzheimer's disease is a specific disease and the most common cause of dementia. How do dementia and mental illness differ? Dementia and mental illness are distinct concepts with different characteristics and causes. They differ in onset age, symptom characteristics, and treatment approaches. Dementia is a set of symptoms involving cognitive decline due to brain cell damage, affecting memory, thinking, language, and behavior. It primarily includes Alzheimer's, vascular dementia, and Lewy body dementia. Symptoms of dementia include memory loss, reduced language understanding, impaired judgment, and difficulty performing daily activities. Dementia is mainly diagnosed through neurological evaluation and clinical diagnosis, and typically affects people over 65. Managing symptoms and improving lifestyle habits are crucial. On the other hand, mental illness encompasses various psychiatric disorders, including depression, anxiety disorders, schizophrenia, and bipolar disorder. These are primarily caused by genetic factors, environmental factors, and neurotransmitter imbalances. Symptoms of mental illness include mood changes, thought disorders, and behavioral changes, which directly impact an individual's life. Mental illness is diagnosed through psychiatric evaluation and counseling, and treatment often involves medication and psychotherapy. Mental illness can occur at any age. The main differences between the two conditions are onset age, symptom characteristics, and treatment approaches. Dementia primarily affects people over 65. While mental illness can occur at any age, dementia is characterized by cognitive decline, whereas mental illness involves mood or thought disorders. Treatment approaches also differ, with dementia focusing on symptom management and lifestyle improvements, and mental illness often requiring medication and psychotherapy. In conclusion, dementia and mental illness have distinct characteristics and causes, and accurate diagnosis and appropriate treatment are essential. Dementia refers to a syndrome involving cognitive decline due to brain cell damage, primarily affecting people over 65, and requires symptom management and lifestyle improvements. Mental illness encompasses various psychiatric disorders that can occur at any age, with mood or thought disorders as primary symptoms, and typically involves medication and psychotherapy. How do dementia and memory loss differ? Dementia and memory loss are distinguished by their causes and symptom characteristics. Dementia refers to severe cognitive decline due to brain cell damage, affecting not only memory but also language, thinking, and problem-solving abilities. This impacts daily activities significantly. Dementia is primarily caused by conditions like Alzheimer's, vascular dementia, and Lewy body dementia, and symptoms worsen over time, often progressing over months or years. On the other hand, memory loss typically refers to temporary or mild memory impairment, absent-mindedness, often caused by stress, fatigue, or aging. Memory loss is usually limited to short-term memory and does not significantly impact daily activities. Dementia is confirmed through neurological evaluation and clinical diagnosis, which is crucial for determining brain cell damage. In contrast, memory loss generally does not require neurological evaluation, and lifestyle improvements and stress management are beneficial. Dementia requires symptom management and medication, as well as lifestyle improvements. Memory loss is typically managed through lifestyle improvements and stress management. Therefore, distinguishing between dementia and memory loss requires considering the severity of symptoms, progression rate, and impact on daily activities. Accurate diagnosis must be made by a professional. Additionally, dementia can significantly impair daily functioning, making independent living difficult, while memory loss usually allows for independent living. Understanding these differences is crucial for the proper management and treatment of dementia and memory loss. Understanding dementia accurately is not just about expanding knowledge, but also about providing warmth and support to dementia patients and their families. It is an important first step in managing and treating dementia. That's all from Silver Queens for now.